What's up, people? We got a couple of Elevate docs, the ones from Illinois. I'm Dr. Zach Couples and
Dr. Logan Ponce.
And we're here to help you sift through meniscus tears. Do you need to do anything about them? How do you know if you have one? What kind of conservative measures can you do to make them better? And if you do need surgery, what are the answers? That's what we're going to talk about today.
Meniscus surgeries. We know, in case the meniscus is the shock absorption that we have inside the knee. It helps us when we're changing directions, cutting, doing different types of wide ranges of motion, specifically into flexion. So what we want to do is, if you are having symptoms, what would those feel like? I guess we should probably first kind of talk about.
Yeah. So typically, meniscus symptoms, if you did have a tear, and this can happen with trauma or just over time, you might have locking out of the joint and you'll have a difficult time bending the knee. You might have giving way symptoms. You could have pain that's on the sides of either of your knees. All of those are generally telltale signs that there could potentially be a meniscus tear. But what they don't tell you is that a lot of times you could have a tear and it may be asymptomatic, or if you do have a tear, you might not have to do anything about it.
Exactly, and that's what research has shown recently, is that people that have a good, well-structured program specific to dealing with these knee symptoms, you can actually avoid surgery rather than going under the knife, which is huge.
Yeah.
Because what we want to try to avoid so much is having any true change physiologically inside, which obviously if you're going to need surgery, there may be some removal of that. So we want to make sure that if we can help it, we want to try and stay conservative as much as we can to avoid getting cut open as much as we can.
Yeah, and get this, folks, actually some of the major studies where they compare surgical to non-surgical outcomes, over a year's time, the results are typically the same. So if you can avoid going under the knife, because there are complications that happen with that, you could potentially die if you do that, you probably should. Another interesting study that they did regarding meniscus cleanup is they did two groups, and one group got the surgery and the other got a placebo surgery, where they literally just poke holes in you and they don't change anything in the anatomy. And guess what? There was no difference in outcomes in either of those instances.
Yeah.
So if you have a good conservative program that helps restore range of motion in the legs and gets your lower body stronger, you might be able to avoid it. So, Dr. Logan, what does that look like? What are some major keys, would you say?
Well, the big things that you want to try to avoid is stressing that meniscus structure further. So any deep knee flexion, deep knee bends, those we try to avoid those as much as we can. Any high impact activities we want to try to avoid, because again, that meniscus is a shock absorber, so you could potentially do more damage if you're doing, say, squat jumps, lunges, things that are explosive, that have a high amount of impact force, even running sometimes. Any landing, planting, and twisting motions, those can aggravate things further. So if you're dealing with these things, those are the types of movements you want to try to avoid when you're trying to get back and recover and gain your strength and function back.
Yeah, and especially in the beginning, if you've just had this injury.
Yes.
Now, if you want to build up to be able to do those things, because maybe you want to play a sport, or you're someone who likes to go hiking in wonderful Las Vegas, and you might have to recover from a twist. We want to make sure you're doing things within a comfortable range, such as squatting, step-ups, any type of deadlifting-based activities. All of those can be really helpful in the beginning towards helping restore strength in the legs, range of motion in the hips, and then anything, too, that you can do to work on your ability to get full range of motion back, if that's limited, would be huge. Yeah. And a lot of those moves, when they're coached well, can help you along that pathway.
Absolutely, and that's one thing to make sure that if you are, you're working with a fitness professional or medical professional, would be best just to ensure that you are doing the appropriate things that won't aggravate these symptoms, damage any structures further.
Yeah, but sometimes you can have the best of programs and you still might need to get surgery.
Yeah.
Dr. Logan, what do you think about when would you tell someone, you probably should get cut with this? What are some of the things you look for?
Well, again, it would be always best to start with a conservative program. So try to do a exercise or rehab program to see if we can get some symptoms without having to get the surgery. But again, if that is indeed the case, that we've tried it, you've gone through 4 to 6 weeks of a standardized program and still get those symptoms, we want to make sure that we are trying to minimize the symptoms as much as we can. And if you are continuing to wake up in the morning with a lot of stiffness, at the end of the day, it really is just a knee joint that you just cannot function on, that's when you're going to want to be considering getting that surgery.
Absolutely, especially if there's no change whatsoever within that 4 to 6 weeks.
That's really the big thing, is if there's not a change, if you're still having limited range of motion, if you get chronic swelling all the time, all those things are going to be impeding, and overall you're preventing yourself from doing functional things. And so over time, if you're avoiding doing stuff, that will put you in a worse state overall.
Yeah, absolutely. Now, if you do by chance need surgery, there's typically 2 ways that people will go about getting the meniscus taken care of. One, they'll just take it out, which is called a meniscectomy or a scope. The other would be a repair of the meniscus. And if you have a choice between the 2, if you can repair the meniscus, even though the recovery is a bit longer, you're going to spend some time not weight bearing, it is generally preferred over just getting the snip. And the reason why that is when they compare those 2 groups, the people who can better preserve the anatomy and not have any changes generally have a less likely incidence of developing arthritis down the line, because a lot of times when the anatomy changes, and it's not always given, but you are more at risk for, as you get older, needing further surgical intervention, such as a total knee. And so if you don't want a total knee and you can get it repaired, it's a good idea to do so.
Yeah, you want to try and maintain that shock absorbed structure so you don't get that overall bone-on-bone formation that will lead to the arthritis, which will lead to all kinds of other symptoms and issues. So yes, if you can avoid getting rid of the meniscus and keeping it intact as much as you can, that's what we want to try to do, and that's what you should obviously try to discuss with your surgeon.
Yeah. So let's provide a quick recap then for those of you who got all this wonderful information. You're like, whoa, what to do? So meniscus, it is a problem if your knee is locking out, you're getting pain around the joint line, you get some swelling, and you get some giving away. If that happens, you're going to go with a more conservative approach first, which would be a really good strength training program, slowly introducing things like jumping, cutting, and things like that. Ideally, you're working with a professional, maybe someone from Illinois.
I hear those are pretty good.
Yeah, probably the best PTs come from Illinois, but we're slightly biased.
That's what I heard.
Yeah. And then last but not least, if you do need surgery, you should probably try to go the repair route, even though it's a little bit longer, over the scope itself. And that's pretty much the long and the short of all things meniscus.
Yeah. All right.
Yeah. If you have any questions for us, or maybe you're like, my knee does hurt, and you'd like to chat with one of us, you can sign up for a free 30-minute discovery session. Give us a call at 702-558-2151, or find us on the web at elevatesph.com, and Dr. Logan or I will be able to take care of you.